In West Virginia, we have one of the older populations in the United States. We also have a population that has experienced difficulties in accessing healthcare over time. The EXCITE project is short for the Extension Collaborative on Immunization, Teaching, and Engagement. It is an initiative that is being led by the Extension Foundation. An important partner in this whole project is the U.S. Centers for Disease Control and Prevention. During the pandemic itself, the Extension Foundation, working with CDC, engaged land-grant universities across the United States, including West Virginia University and West Virginia State University, in this project to essentially get word out on COVID-19 vaccine availability and to address issues of competence and hesitancy. And so that became a platform to reach adults, to talk to them about the importance of understanding the vaccine and making that decision to get the vaccine for the betterment of themselves, for their families, for our communities. And so that was EXCITE 1. That was the very first iteration of this project. Here in West Virginia, we gave particular attention to face-to-face work, vaccine events, education events that would help families understand the COVID-19 vaccine and its availability. We were so fortunate to partner with our other land-grant university here in West Virginia State University, and their extension service. So initially, our platform was to work with West Virginia State University and the Healthy Grandfamilies program that they initiated and that we all participate in.
We believe that grandparents are kind of like uniquely positioned in a way that they are probably not closer to information like you would if you were parents in this generation. And we often also saw that grandparents are in charge of taking care of their grandchildren. West Virginia is one of the states that I've seen that grandparents taking care of their grandchildren, I think 4th in the nation for that. So we wanted to really focus on this particular audience to see how we can bridge intergenerational gap in terms of information, education, and the likes. So we did the rapid assessment and we saw that, yes, there are lots of fears, right? Not sure of what the vaccine will do to their grandchildren. So from there, we moved forward to EXCITE 2, which basically focused on education and awareness. So we've seen what they are saying. How then can we move forward and start to do what we know how to do best in extension by translating science information and making it applicable for individuals in the community. So beyond programming, EXCITE is situated. The vehicle for the implementation of the program is Healthy Grand Families. So we inserted EXCITE into the Healthy Grand Family program. But outside of that, we've made connections with West Virginia Prevention Science here in WVU. We've made connections with the School of Pharmacy and also with the Public Health, School of Public Health as well. So we have investigators across WVU who have at one point or the other worked with us to kind of like push the right messaging. We don't see ourselves as an expert. Extension is, we are in between the research and the people. So we are also leaning on experts in the field, right? Telling us what are the myths that we can see in the community and what are the facts of vaccine. Relying on that knowledge, that is what we take to the people, for the people to have all what they need to make their decision.
This became the foundation of the next stages of the EXCITE project. EXCITE 2, and what we now call EXCITE 3. And these efforts focus primarily not only on COVID-19 vaccine education, engagement, and access, but very importantly, vaccine education, outreach, and access issues surrounding other adult diseases, whether it's pneumonia, hepatitis, tetanus, shingles, a whole host of vaccines that adults should consider getting.
COVID-19, because of all the controversial topics around it, could have, right, prevented individuals from actually taking the vaccine or even introducing the vaccines to their kids. So, but I think opening it up to vaccine in general kind of like helps us to not only educate individuals about other vaccines, but to also compare and say, if you've taken flu, then COVID-19 is also in the same light. At some point, this was developed to prevent people from getting, the flu, right? So I see it more of opening it up and having people have the access to the information as it is, rather than going through other means that might not be evidence-based.
With Excite One, our reach is across the state. We've had the great opportunity to host information booths at the state fair, but we are concentrating on 5 counties with Excite 3. Those counties include Logan, Lincoln, Mingo, McDowell, and Wyoming counties. These 5 counties emerged as examples, as areas where we might be able to engage the communities around vaccine education. Communities that were demonstrating lower levels of vaccine take-up, communities that were medically underserved, also communities that were experienced as the Appalachian Regional Commission might designate as economic distress. But there was another important part of all this as well, and that is these communities have rich and dynamic community organizations that we could work with as well, including local health departments and other community organizations. In addition, both West Virginia University Extension and West Virginia State University Extension have a presence in these counties. And here's another important thing. While we are working with these 5 counties, we are also working within our own extension community. Our faculty, our specialists, our agents across the state to help them become more confident in providing information on vaccines. So 5 counties where we're going to be on the ground, all 55 counties where we are reaching extension professionals.
We should also not forget our charge of being in between the source of knowledge, the university community, and also the people in the community as well. So continuing to bridge that gap, translating science. If we continue to brew science in the university community without the use, then science is nothing, right? So we have to constantly extend that knowledge to folks in the community, just like we are doing for farmers, just like we are doing for youth. We also have a role to play in health. So Excite 3 is also pushing beyond that to look at extension professional self-efficacy, the level of confidence in infusing vaccine education into their already grown and developed programs.
West Virginia is not simply taking this program off the shelf and implementing it. We're developing knowledge. We are developing approaches in partnership with these communities that can help to inform our colleagues across the national extension system. We've picked up so many lessons from our colleagues elsewhere. It's been really helpful. And I think in some small part, we've contributed to their knowledge as well.